what makes New York City such an interesting city to study in terms of obviously U.S. public health policy. It's the largest city. It's the most diverse city. But globally speaking, New York City's public health establishment, the Department of Health, goes back at least 150 years. So they have experience and knowledge and a track record of addressing these problems. These were 5 of the kind of significant public health threats that the city faced over the last several decades, and that's the focus of the research. I chose those 5 because they illustrate a range of conditions in terms of the causal factors. So you've got some conditions like lead paint poisoning, West Nile virus that really have a single cause, and then you've got conditions such as asthma and obesity that have multiple causes, so I wanted a range there. The fascinating aspect of public health policymaking in any city, but maybe New York City in particular because of its size and diversity, is that public health authorities, the political system, never knows what's coming next. Mm-hmm. So when AIDS hit in the 1980s, there was no warning that it was coming. When West Nile virus hit in the in the late 90s, there was no warning. So political systems, sometimes can anticipate threats. Obviously, obesity was kind of an emerging problem. Smoking was an emerging problem. But there are others that kind of spring up. Public health professionals always make the case on the merits. And making a case on the merits doesn't always succeed. And it may be that the nature of the problem has to grow, and there has to be a fire in order for the politicians to see the real impact of the harm being done.